Okay, sounds good. Thank you. I didn't have to say that into a mic. Oh my God. You want coffee? There's a coffee machine on the 5th floor. Yeah, but it's super easy to. Do you want coffee? Tea? Oh, that type of caffeine. Uh, we don't have Celsius at this office. All right. Sorry. We're going to slowly start. If you could wrap up your conversations. There are still some chairs in the back. Thank you. Thank you. Thank you very much. Hey, Lisbeth? 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 Can you like tell everyone to sit down? Yeah. Oh, can you tell everyone to sit down? Yeah, thank you so much, David. All right, yeah, sorry, just give me 1 second. Oh no, I was just gonna ask you to like tell everyone to sit down, but I think David's already doing that. Do you just wanna
Yeah, I'll just.
once everyone sits down? Should we? Oh.
Yeah, but there's speakers on here. Is there YouTube? Is it YouTubing now? Is it YouTube live on? Is it YouTube live on now? Excellent. All right, if we could have the speakers head towards the podium, we can get started. Hey, yeah. Welcome, welcome. Oh, but when the speakers, oh, okay. You want me to introduce the club first? Okay. But I mean, I think people should head up first, then I'll kick off the event, huh?
Oh no, I was just gonna do a quick intro of our company.
Okay, okay. Let me introduce the club.
Okay.
All right. All right. Okay, so we're gonna get started. Thank you all for coming out tonight. For those of you who have been following us, this is now the second event of the year and the fifth event of the 2025-26 season of the Digital Health Track for the MIT Club of Northern California. Today, we're actually very fortunate to co-host the event with the Harvard Club of San Francisco. So it's very nice to see all these new faces, and we should do more events together, absolutely. And I'm also glad to have this event in San Francisco. We've had a lot of events in South Bay, and I'm happy to see people here. All right, so what we do, I mean, you can go to mitcnc.org, and if you're not a member, sign up. But specifically for the Digital Health Track, we've made a commitment to host an event every month because we love getting people together, we love exchanging ideas in healthcare, and we have a passion for digital health. Today's topic is one that's receiving a lot of attention in the news lately, AI in healthcare. On April 2nd, we've got Dr. Lustig coming back, and he's talking about preventing dementia. So that's going to be a phenomenal talk. Last time he spoke to us about nutrition and food science was 2 years ago, and the room was packed. He's a very, very engaging speaker. So please register for that. That's up already. That's on April 2nd. And then in May, we're going to have a women's health event, again, along the digital health lens. We're always looking for volunteers. So if you do want to volunteer for the club or for the Digital Health Track specifically, please reach out to me, reach out to Toku, reach out to David Yin, and we'd be happy to get your name. We're still looking for an event to do in March timeframe and one in June, because we want to keep up our monthly thing. So if you have ideas and you want to host an event, there's a subject you're passionate about, we'll make it happen. And with that, I'll hand it over to our hosts. Thank you very much for hosting us, and let's get started.
Cool. Thank you very much for the intro of the MIT Club. I guess I kind of represent the Harvard Club. Thank you so much, everyone, for coming today. I am one of the co-hosts, so this event is co-hosted by the MIT Club and the Harvard Club and the Harvard Business School Club. Thank you, Alexandra. I don't know if you're here. And also my startup, Clay, QLAY. And before we jump into the panel, I just wanted to quickly introduce what we do and myself. So I'm one of the co-founder, I'm the CEO, and my co-founder is doing the live stream here, Toku. Please say hi to him afterwards. What we do is we do AI user interviews. We built a platform that conducts AI native user research for tech companies testing out their products, as well as consumer brand companies that want to conduct user interviews. Traditionally, user interviews were done by outsourcing it to research agencies, but this tends to be very, very expensive because people have to do the actual moderating of the qualitative user interviews, but we're able to use conversational AI to scale user interviews, both for tech products and consumer products, thereby cutting a lot of the costs of a traditional research agency. If you're interested, please let me know later. But some of you may be wondering why I'm moderating a healthcare panel. I do not know. I'm the co-host, and I am in this office, and I guess I was able to collaborate with the Harvard Club and MIT Club, which has been very, very fortunate. A quick shout out to the accelerator that is in this building. It's called OnLab. They are a $100,000 accelerator for pre-seed. Very generous in terms of valuation. If you're curious about it and you're a startup, please let me know as well after the panel. That's about it. That's my LinkedIn. I'll be around after the panel as well, so would love to get connected, and looking forward to chatting with you all later. Cool. That was the last slide, I think. That being said, I think we can jump into the panel of today. Do you guys want to come up on stage? Cool. Please give a round of applause to the panelists. Thank you. Yeah, can you guys sit in the... Oh, okay, perfect. All right. Thank you, thank you. I get the very, very cheap chair because we didn't have the nice chairs, but that's fine. Cool. Thank you all so much for coming today. Maybe you guys can start by introducing yourselves. Maybe start with Afsana.
Hear me? Great. Hi, everyone. Good evening. It's wonderful to see so many faces here. My name is Afsana Akhter. I am MIT undergrad, EECS, and MEng, and now live in California. I started my career in engineering, so after studying EECS, I worked as an engineer for 6 years, loved that, and sort of serendipitously ended up in healthcare after that. So for the past 20 years or so, have been working in digital health, helping innovative companies, startups, take our solutions to market and gain adoption by payers, providers, employers mainly. After my engineering work, I worked at a health tech innovation consulting firm called Medulin in the Boston area. And then in 2015, moved out here, took a role with Livongo where I led payer sales. Livongo had a really cool solution for helping people manage their diabetes on their own, self-managed diabetes. And the company, we mainly sold to payers, providers. Company IPO'd in 2019 and then was acquired by Teladoc in 2020. And then after that, I worked in a number of other areas, predictive analytics, mainly focused on payers. And then in the pain management space, also in the mental health space, I was the CEO of a mental health platform company. We provided that platform to therapists to better support consumers and patients in their mental health journeys. Currently, I am the Chief Growth Officer of a company called Aible, We have a platform for augmented analytics and agentic AI, and we work with healthcare as well as other verticals to really help organizations bring AI within the grasp of business users. If many of you have read that paper published by MIT where many projects fail primarily because business users are not involved in building AI solutions, and so we wanted to really bring AI within the reach and ease of use of business users.
Hello, everyone. I'm Max. I'm building a company called Superpower, superpower.com if you're curious. We're creating a new healthcare system, just that small, challenging thing. The current healthcare system is very good when you're sick. It's very good at surgery, but it's awfully bad at preventing things, and it's awfully bad at actually enhancing and improving human life. Right? If you go to your doctor and you say, "Help me be happier," or fitter, or younger, or smarter, or more energetic, or "help me prevent things decades in advance," the healthcare system doesn't do an awfully good job of that. So we believe a new system is going to emerge in front of the existing one that prevents disease and enhances human capability. And that's a little bit about what we're building.
Congratulations on the big Series A announcement last year. Awesome. For context, Max was able to raise $30 million for his Series A last March. Awesome. All right, I knew that. Okay, thank you.
Hi, everyone. Thanks for having me. Excited to be here. My name is Michael Turken. I am a physician. I'm an internist, urgent care doc at UCSF, but most of my career has been in the health technology space. I was an early clinical product person at Forward. If you're not familiar with Forward, we were building a new healthcare system, tech-enabled, AI-enabled. Sadly, they closed their doors, I don't know, about 6 months ago. Also did work at Omada Health, helped develop programs for people with diabetes, hypertension, to self-manage their conditions, very similar in a way to Livongo. And then spent some time at Google, worked on the Fitbit team, also worked on the Google search team, which ended up being the inspiration for founding My Doctor Friend, which is what I've been doing lately. So My Doctor Friend is a patient-facing health companion. Really, I set out to build the tool I wished all my patients had. Most people, especially people with chronic or complex conditions, are alone with their health conditions 99% of the time. We expect people to self-diagnose, self-triage, manage their own treatment most of the time, and I wanted to develop a solution that helps people navigate these kinds of decisions.
Awesome.
Hey guys, I'm Robin. Nice to meet you all. This is on, right?
Yeah.
Cool. I used to be in the biotech space, and now I'm back in the biotech space. So I studied biomedical engineering at Columbia, did not get into Harvard or MIT, unfortunately, so you guys are already ahead of me. I spent quite a few years doing consulting in biotech, hated working for big pharma, came out west to work in video games, of all things, and then spent 4 years at Andreessen Horowitz doing venture capital investing, mostly in consumer, some in health, set up our program called Speedrun, which is our premier pre-seed accelerator. We have, I think last cycle we had 19,000 applications or so. And so very competitive, very good program. Recently left because most of the investments that we were making are now more in the B2B agent side, which I think will be very good for my carry, but not what I was put on earth to do. And so now I'm back in the biotech space, working on a new stealth startup with a couple of my colleagues and family. So my dad was the head of biomedical engineering at Columbia. We have another professor who is an expert in nanoparticle drug delivery, academy professor, 40 plus years in this space, 30 plus patents, and we are going to go commercialize some of his technology.
All right. Thank you very much, Robin. Maybe we can start with a couple questions for Max and Michael. I know that your product offers a lot of personalized health for everyone. Is that accurate? Yeah. Would you be able to maybe elaborate a little bit on what kind of personalized health you offer and what that means in the first place?
So I think it's interesting thinking about what personalized health is not. which is kind of what we all get today when we go to the doctor's office. We go in, we get a blood test, we get the results back. The range is the same for everyone. We don't consider age or gender really, or ethnicity, or what's really going on for you. The doctor doesn't really consider your goals. If you ask your doctor, what are the 5 things I care about most in life? They don't know, right? They've got 5 minutes with you. They're trying to build the system as much as they can and spend the least amount of time with you possible. That's kind of where we're at today. And then when they make recommendations, it's kind of like, what's standard of care? What was I taught? Maybe now the doctor's a little bit more personalized because they asked their buddy ChatGPT. And maybe ChatGPT knows a little bit more about you, so they try to personalize. But it's still not awfully personalized. Now, if we look at where we will go in the future is a world where every single person has diagnostics that are unique to them, where we create a baseline of someone that is their baseline, and we compare to that. Right? Everyone has different ranges, everyone has a different optimal. Age bears on that, gender bears on that, ethnicity bears on that, goals bear on that. Whether an athlete or not an athlete bears on that, right? So we have different diagnostics. And then we certainly have different therapeutic pathways. It's my belief that every single person in some way is a diagnostic odyssey, meaning everyone is complex in a way that's not obvious. And therefore the pathway to actually make people optimally healthy is deeply individual. And in a world where we're constrained by human computation and what a human brain can do and a human doctor can do, we can't handle that complexity. We can't really think of everyone as individual and different and unique. And yet in a world of AI, we can start grappling with that. So if I look at what personalized medicine is and what we do, we start by testing someone over 100 plus blood biomarkers. We can do other testing as well. We build a full profile of you, family history, personal history. What are your goals? What are your preferences? That all matters. All of that goes into determining what you should do. Right, and from there, we try to tell everyone, for you as an individual, not as some amorphous blob in kind of the sea of everyone. For you as an individual, here's what's right for you. And then over time, the system learns and gets better at working out what is right for you. And that's kind of the world we're moving to, which is this world of personalized care.
Michael, do you have a take on that?
Yeah, I agree with a lot of what you said. I'm going to give a take that's a bit more charitable to physicians. I'm a bit biased. I think most physicians are genuinely trying to do their best in a system that's just deeply broken. I think healthcare is fairly well personalized, but just not equally and not in the places we might like. I think primary care, we just don't give docs enough time to really personalize care. 15, 20 minutes is just not enough. On the other hand, I think there are areas of care where what we're doing now is just incredible. If modern cancer care is, we will sequence people's individual tumors. We are living in an incredible age of personalized care. It's just not evenly distributed. Where I think we agree a lot is that the promise of AI is allowing people to achieve more personalized healthcare no matter what system they're in. And this is kind of what I've seen in how people are using My Doctor Friend, which is, we have folks, they're very well plugged into care. And many of the folks that get the most value out of My Doctor Friend, they have multiple diagnoses like heart failure, cancer. Their trouble is not necessarily that they don't have a doctor or that they're not getting individualized care. It's that their care needs just exceed what any healthcare system is capable of delivering, right? So I sort of see personalized healthcare as, someone that has some terrible symptom at 11 o'clock at night. And currently in our system, oftentimes the only decisions are like go to the ER or stay at home, right? So people don't, there's not much flexibility. I think AI systems like My Doctor Friend can help bring in a future where these kinds of decisions, where they happen, changes, and these decisions are a lot more nuanced.
Thanks, Michael. I think obviously the concept of AI has come up in both of your answers, but maybe would love to ask any of you about what are some things that AI is better at than a real human, and what is some things that AI is still a bit overconfident, or what is something that is still not being done at all by any AI? Or yeah, maybe Afsana.
Yeah, I think what AI can do better than humans is look at vast amounts of data, process that data, and give us insights that are useful. And to do it quickly. So that's one of the things that the company I'm at, Aible, does. We can look at millions, billions of rows of data, variable combinations, and proactively pull out trends and changes in a way that wasn't even possible a couple of years ago. One, because either the data wasn't ready or accessible, the compute power wasn't there. So we're, these AI systems today are able to do things that are superhuman, and that frees up the humans to do what humans are really good at, which is things that require context. And so, yeah, I think that's one example.
Anybody want to add on top of that? Robin?
I have a very spicy take, so I don't know.
All right,
Do you guys want to hear the spicy take?
Everyone listen up.
All right. Obviously, I'm a little bit AI pill because I worked at Andreessen Horowitz for 4 years. So take what I say with a grain of salt. But I think we've seen a lot of the AI advances in the last few years. I think AI is coming for most of our white-collar jobs, which is like most of us sitting here. Because if you look at the advancements of how quickly the curve is going, it was only 3 years ago that we had ChatGPT and we were like, oh, it hallucinates all the time, it kind of sucks, gets all my answers wrong, blah, 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 blah. How many of you guys have used Opus 4.6, like Claude Cowork or Claude OpenClaw? Okay, so a few people. All right, great. So if you guys see where it's going with with Claude Cowork, which is not that good right now, but if you just like use it, go home, open it up, try a few things, it's very quickly going to have access to our entire computers, have access to all the internet. And so I would encourage you to go home right now, read Dario's essay, and then also open up Cowork, right? Because it will now have context for the entire web. It will have context on, the models are really freaking good now. It used to be, like, I'm a pretty good writer, as an example, and I used to be like, oh, the AI sounds kind of AI, it doesn't not that good, I feed it all this context, it's still not that good. Now with 4.6, I feed all my writings, sounds pretty good. Sounds kind of like Robin. Like, produces pretty good stuff. I'm like, man, your writing's pretty good, man. And I think this is happening if you talk to people who are in charge at like law firms, software engineers, like even, I don't know if you guys follow some of the notable AI researchers, but even Andre Kaparthi was like, hey, the last literally 3 months, I've gone from coding 80% of my work to coding 20% of my work. And that's because the models are moving so quickly. And this is not even accounting for when things get recursive, right? Which is like, hey, Cowork was built 80% by Claude, right? And so once you have things that are doing, and I know this is like kind of like AI doomerism, blah, 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 but like I really do think that like we don't fully appreciate yet all the things that AI is gonna do. And what is very apparent to me is whatever humans can do on a computer, AI is very quickly going to be able to do. So I don't know what kind of field it's gonna affect. It's not gonna affect everyone, but it's definitely gonna be a brave new world for sure. So that's my hot take.
For all of us.
I actually like your take. I'll maybe sort of stand somewhere in the middle because I agree with you. I mean, the pace at which AI is getting better is just it's spectacular. But I still think that AI of today has really important limitations. The first is its memory. We've been kind of stuck at that 1 million context limit, and that is a real limit. And a lot of at least in the healthcare space, there's far more data, and that you blow past that context limit really, really quickly. So there are real technical challenges still to be solved until these models have better memory. The second thing is sycophancy. All these models are trained to be people-pleasing. And unfortunately in healthcare, that's a huge liability because oftentimes, and I think I heard there's some clinicians in the audience, if you want to raise your hands, you probably know that oftentimes like you can't always be agreeable. Some things in healthcare are just intrinsically sort of hard and difficult. To be like really concrete, these models are terrible at getting a sexual history from people. They don't want to ask invasive questions that are going to make people feel embarrassed. but that's a huge liability in healthcare. And then overconfidence, I think, is the last problem. The models are getting a lot better, and I think probably in a lot of spaces that confidence is warranted, but I think the combination of these three things, technology that forgets, it's people-pleasing, and overconfidence, still leaves, I think, significant space where we have to overcome some of these challenges and sort of adapt to the technology. But deep down, I agree with you. I think this is like, this is the new electricity. We just have to figure out how to not get electrocuted, being so excited about being, putting light bulbs everywhere.
I remember a month or so ago, I was quoted in an article by a reporter saying that AI would prescribe within 3 years. And the idea of the quote was saying, this is crazy, found the things AI is going to prescribe in 3 years. And then literally 2 days after, Doctronics starts prescribing in Utah. And like that moment for me was this moment of, holy shit, even when I'm making an extreme prediction or a prediction that the world thinks is extreme, it's still nowhere near extreme enough. And that's an exponential, right? And I think every single person probably in this room is underrating what is going to happen, including me. And it's like one of those things where even if you know you're underrating it, you're still probably underrating it, right? And it's so hard to grasp, so hard for our brains to grasp. And I don't think that's in 5 years or 10 years. I think that's sometime probably in the next 2 or 3 years where we get to this world where we're quite worried about AI. Partially because it's taking jobs, but more because of everything else. If I look at the main limitation today, I think the main limitation today is that it cannot really, it's not that good at determining priority. If you ask it, what should I do for my health? It gives you a list of 10 or 20 things. It doesn't say, here are like the 1 or 2 things, given everything we know about you, that you should do for your health, right? And that's not necessarily a limitation of the AI. You can kind of like fine tune and prompt your way out of that. So I actually think that's still like a limitation of how it's applied rather than the underlying model itself.
Thank you. I think the common thread of that was AI is progressing really, really fast. It can do things that it couldn't do a couple months ago. But in comparison to that, things that are very slow is obviously the regulators, the big, large companies, a lot of bureaucracies. Are there things that you believe needs to, I guess, is there anything where these large players like regulators need to move to really encourage disruption in healthcare? Because there might be a limit to what a startup can do, or there might be a limit to what AI can do, because there's always going to be humans in the way or regulators in the way. Are there some examples that comes to mind when you think about that?
Can you sue a regulator for like causing harm? I don't know, but play this out as a thought experiment. Already today, we can prove that the AI is safer than human doctors a lot of the time. Fast forward 2 years, it'll be unequivocal that the AI is safer than the doctor the majority of the time. Therefore, by having a human performing medicine rather than a doctor, we are causing harm. Therefore, the regulators, by not allowing the AI to cause to not perform medicine, are causing harm. Let's sue the regulator. I'm kind of being facetious and joking, but you get the point, which is that we're going to have a provable truth. And when we have a provable truth, regulation is going to have to keep up, going to have to change and going to have to keep up. I love this idea of kind of legal arbitrage, which is when something is simultaneously illegal or gray, but good, right? The fact that it's gray means not many people are doing it. The fact that it's good means that the laws are going to change. The law is pragmatic, it adapts. You can put many companies in this bucket. Uber in the early days, Airbnb in the early days, PayPal, Tesla, SpaceX. The list really, Coinbase, the list really goes on. And I think like AI healthcare is potentially one of those categories.
So, as the pragmatist here,
All right.
I hear all these are amazing ideas, but at the end of the day, the adoption is really, really hard still. If consumers are adopting what's free, and I'm here, I hear stories of AI doing things that we can already do. We can prescribe, we can write. What I would love to see AI do is detect cancer in a way that we can't already do it today. Find treatments that are groundbreaking that we can't already do today. But to answer your question, I think what's still excruciatingly slow and hard is adoption, especially for innovative technologies that seek to get paid for the work that they're delivering. And why is that adoption slow? It's because of the monetization pathways, one of which is reimbursement. Reimbursement has always been slow. It's particularly hard for AI. So yes, we do need to work with the people who reimburse, the people who regulate, to get some of the really groundbreaking, beneficial AI solutions more broadly proliferated. And the other piece is, again, great solutions out there, so many great companies, yet you look at their revenues, and it's still very challenging because for enterprises to adopt AI at scale, the ease of use needs to be there, the integrations need to be there. You know, for every solution, at least that I talk about deploying, there's like 5 API integrations that need to happen, and 5 different teams that need to provide data, and then 5 ROI calculations that need to happen. So while I'm very impressed and optimistic by what the capabilities are, I think the adoption pathways still have a long way to go.
But what if the AI does all of that? For example, our
AI
head
to
of
wash my dishes?
our
robots are coming.
So our head of growth on the weekend built a linear clone that's gamified, and you move up levels, and it's fully complete. And the way he created it was he linked to Vercel API, he linked to Superbase API, and that's it. And then he said to Claude Code, I want you to create me a gamified linear. And it worked for like 8 hours, and it created an entire gamified linear. He hopped in to prompt it a couple of times. It set up the database, it set up auth, it hosted it, deployed it, everything, right? It asked him when it needed other API keys, literally everything. And if you haven't played with, to Robin's point, these tools, they show us where the world is going of agentic AI, where all of these blockers are human blockers. They're blockers because we need to do things, and we thought that a human needs to do things. But that's not necessarily the case anymore.
I'll sort of wait. I probably also lean more to sort of being on the pragmatic side of things, because I
Two
don't.
visionaries, 2 pragmatists.
no.
I love this. Is a great panel.
It's good panel. Because I just think, I mean, just historically, healthcare just never changes. It changes, I've heard people say, at the speed of trust, not necessarily the speed of technology. And, you know, when I joined Forward, it was 15 people, and we were saying how we were going to operate in the gray zone. We were going to follow Uber's path, and it did not work out well. Our time was the time was too early for us. I think I think there's another piece of this, which the regulators, to their credit, I think are mostly we'll sort of set aside what they're doing with sort of vaccine policy, but I think regulators nowadays are moving much faster than I would have ever imagined. I mean, it's actually kind of surprising how much they've taken the brakes off of this technology as it's being applied in healthcare, and I think we should be mostly grateful, given the otherwise all the chaos. The second thing is, and I think we forget about this, just sort of grounding us, a lot of healthcare is physical, and AI is still very much, you said this, AI is, if you do it on a computer, AI is coming for your job. Well, AI is not going to be changing bedpans anytime soon. It's not going to be doing wound care anytime soon. There's so much of healthcare, whether it's primary care, specialty care, that still requires highly skilled people. I think we need to temper our enthusiasm with, how does healthcare actually work?
Yeah, I agree with your take for what it's worth. Like, this is going to be dating me a little bit, but I was part of the whole crypto cycle in 2018 and 21. And so I've definitely been through my fair share of, narratives and all this sort of stuff. Crypto's going to change the world, blah, 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 blah. So I do have a healthy amount of skepticism, and I do agree with both of your takes that I think in healthcare in particular, areas where there's a large amount of atoms rather than bits, and areas where there's high amount of regulation will have the probably slowest disruption by AI.
This is completely my personal curiosity, but Michael, you said Forward a little too early for its time. Are you able to elaborate on what you meant by that, or not really?
I mean, how many people here are familiar with Forward? I don't know if it's background. Okay, so some people. So the idea was it was a very tech-enabled, direct primary care practice, and when we started, the idea was that we were going to build for this moment in time. So our thought was, let's build up, this amazing new healthcare system from the ground up. We built our own medical record system, own personal health record. We wanted to make sure that all the data sets we gathered were entirely clean. We had an absolutely perfect baseline, not just, lab tests, but, medical history on everyone who came through our practice. And the goal was to get to this moment when AI would be good enough for us to take that data and actually do something with it. Now, I must confess, I was not with Forward in the last few years, and I think the strategy went in some unexpected directions. They ultimately, one of their last moves was to invest in a sort of standalone, they called it a care pod, and it's worth looking this up. The idea was you would step into this sort of sealed room, sit in a chair that would take all of your vital signs. They had a robot, I never got to try this, I'm very sad about it, that would draw your blood. And then it would process these results. It would sort of walk you through the test results. It was all done, at least so they say, it was all going to be done by AI. And coming out of the pandemic, I don't think people were ready to seal themselves in a in a box and have a robot draw their blood. I just don't think that's what people wanted. But I do think that there was a kernel of truth to what Forward aimed to do, which is, they really wanted to make care democratized, accessible, and primary care available. I mean, they set up these care pods in malls. They wanted it to be where people lived, and I think there was a lot of good to that. But maybe they were 5 or 10 years too early.
Fair enough. Thank you for that. I was just personally curious. Going into, I guess we talked a little bit about like pharma and regulators. If we could, how many of you guys are startup, like people, like work at a startup founders? Okay, good amount, okay. Maybe would love to hear more about like, where are the places that startups can disrupt? Is it consumer health? Is it like provider tech? Or is it like, would you go B2B? I'm not too sure, but what are some domains that you think is a white space in terms of healthcare? Like where in healthcare do you think is a disruptible space for a startup? Maybe Afsana?
I'll answer the question a little differently because I think there are so many problems to solve and so many great potential solutions, so many solutions that are already out there. I think the hardest part for a startup to be successful is to get that traction and adoption and revenue. So when I work with a lot of startups, either inside the startup or advising the startup, et cetera, my suggestion is always measure the benefit. Really measure the benefit that you can provide, that you're going to provide. Start measuring from day one. Figure out how you're going to monetize it and who's going to pay for it. Again, there are great problems, great solutions, but if you don't find the entity or the person that's going to pay for it, how they're going to pay for it, what justifies them paying for it, unfortunately, it's very difficult as a startup to be successful. There may be other exit paths where you don't have to prove revenue, but my number one advice to startups is just start measuring all of these things from the very beginning.
Any agrees, disagrees?
I agree. I mean, I think most of the things that I've seen working so far are kind of what our panel has been talking about, which is, startups that focus on startups that focus on bits, startups that focus on workflows. There's a lot of AI agent startups in like patient recruitment or healthcare back office workflows or entering into your ERP, or the biggest ones are obviously like medical scribe startups, right, have produced a couple big outcomes. I think all of these startups are the areas where I don't know if it's the right area to go into now because there are a couple incumbents in the space, but at least in terms of like what has been successful, it's clear that like coding, customer success, things where there's like clearly verifiable outcomes and outputs where you can, to her point, like measure the ROI very easily. So like obviously, Decagon as an example, obviously not fully in healthcare, but they serve some healthcare clients, which is like, hey, like I have an outsourced, customer service people that I pay this much for solving these many problems. Now I use AI agents. Now this costs me this Y amount, right? And I could just do the math on like how much I'm saving and how happy the customer is. Obviously, I would choose the AI agent startup if the NPS score is high enough, right? So I think for these areas, these are areas where there's clear product market fit. I think for future areas, as the models get better, we'll have to see. This is in like areas of atoms. This is in areas of more complicated workflows. This is in areas of like large data sets that people have to do. This is in areas where like the AI doesn't have as clean data. So that's what I've seen so far.
I think there are only 5 kind of themes or categories that are robust to AGI. So assuming AGI is here, what still matters? I think it's a really, really important guiding question. Category 1 is machine as human or machine as man. That is AI itself, right? That's foundational models, etc. Category 2 is human as machine, right? That's biotech. It's a very Darwinistically primitive thing to improve ourselves in order to ensure continuation of species. And I think that health matters, right? People don't want to die. People want to be better. So category 2 is kind of human as machine or biotech. Category 3 is world as machine. This is manufacturing, onshoring, deep tech, hard science, all of those things that actually deal with the real world. AI is not awfully good at solving problems that actually require coordination in the real world. We still need real world endpoints. So they're probably the 3 categories that are really interesting. Category 4 and 5 I don't think are venture backable per se. And I think it's interesting to think about what does it look like to map health onto these categories, right? Like even for us, I'm kind of like, okay, a lot of what we do today is like highly defensible in a pre-AGI world, but assuming AGI is here, what matters, right? And say, oh, okay, we're probably going to have to vertically integrate and own pharmacies and maybe labs. That's going to be important. That's kind of a world as machine concept. Okay, we're probably going to have to grapple with biotech, and we're actually launching our first 2 kind of drugs later this year. And that is partially because I care about that and we should do it, but it's also partially because assuming AGI is here, what still matters? And I think these are the areas where you find defensibility, and I'd kind of suggest everyone to, if you're starting something, filter what you're starting through these categories and lenses.
I can give maybe a slightly different take. That's very interesting. Yeah, I've heard some people say that maybe AGI is here and we just haven't acknowledged it yet. When I advise startups, I actually gave very similar advice, which was, figure out how you're going to get paid for this. Definitely don't do direct to consumer because it just doesn't work. And unfortunately, I could not take my own advice. And the thinking, at least for me, behind this has been, just looking at who is most upskilled by AI in any kind of discipline. And I think far and away, at least in the healthcare space, the person most upskilled by AI is the patient. And I think, my hypothesis, and I think Superpower is probably bearing this out somewhat too, is that there's a lot of promise in upskilling patients. They're probably the most underutilized resource in a way in healthcare, especially for the parts of healthcare that still require, that are, atoms, not bits. The question is, how can we really sort of upskill patients, and how many patients, the technology adoption is not going to be right away. And I was in urgent care a few weeks ago, and I, saw a pair of siblings in their 80s. They were struggling to live on their own. They could barely get their phones to work. Not everyone in the world is going to be able to use this technology, so we have to keep that in mind. But I do think that focusing on patients is worth doing. And then I'll put out just like, if there are, because I heard there's some startups here and that they're working on something. What I would really like, and I think there's a huge empty space here. We've done a lot trying to sort of create the sort of AI doctor. And I think a lot of people are sort of working that and approaching that from a different angle. I actually think the bigger challenge right now is someone needs to create the AI patient. Because our AI doctor systems are impossible to test, because AI is very bad at pretending to be a patient.
Awesome. Maybe one last question from my end before I open it up to audience Q&A, which I'm sure a lot of you have been waiting for. My last question is, looking ahead 5 to 10 years, what part of healthcare do you think will be unrecognizable compared to now? I'll open it up to the floor. If anyone has their own take, go for it.
I can start. I can share with what I would like to see, and particularly in healthcare, is us solving some of the really hard problems, but the ones that have huge human impact, which is better screening, better detection of cancers, better treatment of cancers, things that are still really, really hard to do today.
I think everyone's going to be injecting peptides. Who here has injected a peptide, GLP-1 or other? Wow, that's actually so few. So 1 in 8 Americans has tried a GLP-1. That was the stat from early last year. So now it's probably like 1 in 7 or 1 in 6, which is really interesting because what it means is for the first time, tens of millions of people are taking drugs via injection. That's really interesting because when you can start injecting drugs, you can actually start developing different drugs. Right, we used to all be obsessed with small molecules that are like reasonably effective at oral delivery, but also quite risky and hard to develop. Peptides are small proteins. They break down quite easily if you deliver them orally, so no one put much time into researching them, but they're quite very effective, systemically effective when delivered subcutaneously via an injection. So the fact that tens of millions of people inject, I think, is a paradigm shift for where the future of therapeutics are going. And we're seeing dozens of new peptides being developed, right? Just as we have GLP-1s, which are kind of like the magic drug for weight loss, we're seeing that for cognition. We're seeing that for muscle repair and tissue repair. We're seeing that for immunity. I used to get sick 4 to 5 times a year. I never, ever get sick anymore, ever. There are times when everyone in our office is sick, and I'm like to them, guys, why aren't you taking this thing? I'm not getting sick because I'm taking this peptide. So I think this is one of the earliest themes. I think it is potentially a larger consumer category in terms of revenue than AI. And it already is. Right now, GLP-1s do more revenue, consumer revenue, than all of the AI consumer companies combined. Right? And I still think it's massively underpriced. So it's going to be a $1 trillion category. I think in 10 years, injecting peptides, injecting other drugs is going to be common and mainstream.
People have been injecting themselves with insulin for a while.
Which is a peptide, right?
To be clear. Yeah, I don't know what healthcare is going to look like in 5 to 10 years. I think it's going to be, there's a good chance it's going to be, I think you were right saying it's moved a lot faster than I expected. I mean, Doctronic convincing regulators to allow them to have AI prescribe medications, that happened much sooner than I expected. I'm most excited about where this technology is going to bring research, because I really do think that's likely where we're going to see a lot of the real gains is new medications, just understanding the science more deeply than we ever could before, despite all the underinvestment in the science by the current administration. I think what I find myself, what I sort of blind spot for me, and I'm sort of curious folks in the audience have more experience with this. The thing I'm not as exposed to is robotics and how that's potentially going to change healthcare. I know there are folks that probably have seen a lot more of it. I mean, I've seen demos of these, robots threading needles and folding laundry. Would be very excited to have that in my house. But in terms of what that technology could do for healthcare, that seems like it is maybe underappreciated. And I hope there's someone that's working on, training, maybe training robots to address our massive shortage of caregivers, because that's a whole other sort of public health crisis, and bits are just not going to cut it there.
I love all these interesting takes. The one thing that's on my mind, which is very pertinent because of AI, but also because in bio and drug development, is the US-China dichotomy and how that plays out over time. This is also true for robotics too, because I'm gonna be honest, all the hardware founders I know who are working on robotics, they always go to Shenzhen because it's cheaper, better, faster to make your robots in Shenzhen right now, and they have some of the most cracked roboticists. And if you look at the drones that people are making in China, it's pretty crazy. And so I give my hat off to Elon and all the other people who are working on US robotics and US manufacturing. I think the same is kind of happening in biotech too, where a lot of the things that are being, we went from China was like an outsource like India, where we just they make generics, to, China's producing some interesting research, but they're not in Nature yet, they're not in these big publications, to now China's I think a third of like all the various like Nature science papers in bio, and like, you know, big pharma is also acquiring a lot of the biotech in China too for their assets. So I don't know how that's going to play out in 5 to 10 years. I hope we can figure out a way to get along. I don't know. Someone who's a better student of history and politics can tell me, but that's the thing I think about.
Awesome. Maybe I'll open it up for a couple questions from the audience. If anyone has burning questions, we could take a couple.
Hey. Hi, Gustavo here. I think we talked about a lot about like diagnostics, right? But I'm curious about like AI also about like how to help patients in their treatments, right? Like we have like a huge amount of patients, right, that are chronic patients, like this silence disease that we have around the world, and how AI will help on this part, like that. It's more about like behavior change, right? Like you need to sleep better, you need to eat healthier. So how do you see AI applying also on this other side of healthcare?
I'm happy to take a stab at this, but would be curious what other folks think. So behavior change was a big focus of what we did at Omada Health, and I think, you know, Livongo to some extent too. I think there's a lot of excitement about what AI might be able to do in helping people to change their behaviors. I'm a bit more skeptical. I think behavior change is much, much harder than most people appreciate. That was my big takeaway sort of working at Omada. It's just, you know, I think if you are, you know, if you have a lot of disposable income, you don't have a lot of other stresses in your life, it's very easy to think about, you know, taking all of your medications on time and exercising every single day. But the vast majority of people, they just have other stresses that make that challenging. I think a lot of the challenges we see with you know, conditions like, you know, metabolic syndrome, hypertension, these chronic conditions are often conditions related to just social structure. They're social problems that have physical manifestations. And I think, you know, I'm in general pretty, you can tell, kind of an AI optimist, but I think probably the better solution is, you know, can we sort of reorganize our society to allow people to live in a more healthy fashion, not necessarily give people more AI pals to, you know, send them nudges every morning and tell them to eat healthier and, you know, go for a jog.
I can share a couple of examples. What I get very excited about is the ambient detection of behavior and signals. We've already made a lot of progress in that with so much biometric tracking going on with watches, et cetera, but I've seen demos of ambient detection of electromagnetic waves doing early detection of Alzheimer's and dementia. So I think there's a lot of opportunity from you know, biometric, various ambient signal tracking and AI being able to analyze all that to allow earlier detection of you know, meaningful conditions so that we can treat things earlier and really have an impact.
It's kind of two ways of answering this. Behavior change doesn't work. Like empirically, we've kind of seen that. Everyone in the US got fatter every year on average for the past like 60 years until technology comes along. So my kind of view is the only thing that really works for behavior change is like change culture, change regulation, change cost, change quality, culture is a little bit harder to do with technology. The kind of cost and quality ones are a little bit easier to do with technology. Biotech being particularly interesting there. Again, I'll point to the GLP-1 example as kind of the salve to the weight crisis in the US. I think there's another way of kind of answering this, which is looking at complex diseases, right? If you go to a doctor today and you have Crohn's disease, the doctor will often say to you, there's nothing we can do. If you have a long COVID, they'll often say to you, there's nothing we can do. And there are many of these conditions that are very poorly understood and that standard of care doesn't have an answer to. But there are doctors out there or people out there around the world who have found answers, right? When I have friends who have Crohn's disease, I say, go see this person. And 6 months later, none of them have Crohn's disease anymore. When I have friends who have long COVID and they've seen 20 doctors, I say, go see this person. And sometimes a few months later, they come back saying, I don't have long COVID anymore. So there are doctors out there, not many, and definitely not evenly distributed. They tend to be very expensive. AI can replicate that, right? Though what's in their brain can be put into code and can be put into AI, and that gives people agency over their health and answers that were previously quite hard to come by.
So I appreciate those examples, but I also think you're missing one of the things that AI is already demonstrated to be very good at, which is spreading misinformation. And in most of the cases, the gains in finding the truth are far outrun by the AI's ability to spread things that are not true and find things that are not true. So the example you gave, some of those doctors may actually be doing things that are causally related to solving a person's problem. Sorry.
They really didn't want you to make your point.
There you go. Some of the things may not. And as a society, we have developed mechanisms for consensus, for identifying what we believe. And AI is collective intelligence. It's taking all of human writings and with our processes for finding truth and using that to reflect back to us in a very positive way. But as we know, it can also spread misinformation. So I think the challenge and what the panel has not addressed, and I think it's very hard to address, is that contrast. And in particular, just to Max, since I completely agree with your thesis that we need to make care more personalized and make it available to everyone. But then when I look at the actual panels and what you're charging for, it's very hard for me to see if it's really providing an information gain that is relevant and important, or if it's just simply taking advantage of an asymmetry in information and not actually providing gains. And so those are the questions I think are very hard to answer, but it's really important to phrase them correctly. And it's very important to see, for example, the spreading of misinformation as being the most important crisis in health that we've seen in a long time as a possibility. So I appreciate that, taking that perspective.
Yeah, so there are a few things in here. And I think kind of the frame is AI is spreading misinformation. It's like, let me respond to that. It's like, well, hold up. Let's actually start by asking, is AI spreading more information than currently that was formerly being spread? By social media, by doctors, by books, by articles? I would contend no. I didn't have the data to back it up. Kind Sir doesn't have the data to back it up either. But I think if we just a priori reason, do we think that social media and the internet arbitrarily, formally was spreading more information? Or do we think AI, which is actually pretty good at getting to truth, is spreading more information? Which one do we think is better? I think the AI is a little bit more accurate. So I just want to reject the frame a little bit, because I don't want us to have this discussion of we accept the fact that AI is spreading misinformation, address that, because I don't actually think that's true. The second thing is kind of the jab at superpower here. So one of the things we do for $199 a year is give someone access to 100 plus different blood biomarkers. It's a blood test that someone would get. If you go to Quest, that would cost somewhere between probably $400 and maybe $5,000. People get different prices because that's the nature of US healthcare. We had a member who just came to us and said, oh, I was about to, I went to my doctor and they gave me a smaller panel than this and they asked me to pay $1,900. And you're giving me more for $199. We surveyed our members recently and we said, how does this compare to your doctor? And 93% said we were far better or life-changing. That's a stat, that's data. 63% said they found something their doctor missed. That's pretty important in health, right? This is for $199 a year, so $17 a month, the cost of kind of a Netflix subscription. So maybe not everyone will find value in superpower, but the majority of our members do. And every Friday, well, every Thursday now, we have an all hands. And we bring members in, we hear their stories. And we have members tearing up about things they discovered about them or in their family. And that's powerful. And that's moving. And that's using technology to take something that was expensive and was inaccessible and make that more accessible, right? And I think that's important.
If you get an AI miracle worker somewhere who can cure diseases for the customers, will the protocols be shareable? Or what will the structure be for patent protection on the one hand to protect profits, but on the other hand, sharing of protocols so that the breakthrough, the sort of complex multimodal program that represents the breakthrough can be shared with other providers and overall health of the community can be increased?
Yeah, this is.
I don't know, but you may be better suited. I'm not a lawyer. I mean, I've been sort of following, I think some of the, I can't remember if it was OpenAI. One of the frontier model makers was saying that they might have a claim to the IP that's discovered with their models, which is sort of interesting. I mean, I think it's kind of an open question who should be owning the, the fruits of this incredible technology. I mean, as it is, another thing that none of us has discovered is that, or has discussed, is that all of these models are trained on stolen information and stolen intellectual work. There's a strong argument to be said that all of us should own all of the benefits of these models. But yeah, someone else on this panel may know more legally about IP ownership there.
I think it's kind of a hard question to answer because on one hand, like AI is the greatest democratizing force because we can all buy AI and a super genius in our pocket for like $20 or $100 if you really want to pay. And people are always like, oh, you have this monopoly and AI is going to create this crazy monopoly, but actually in general it's been a democratizing force similar to the internet, right? I do think, so basically if the presupposition is the frontier model labs somehow create a miracle doctor or patient or what have you, I would think that they would probably put it in everyone's pocket, at least Anthropic would. I don't know about OpenAI with their new ad model, but like I know Anthropic would based off like what they want for humanity. Now, whether that's possible with just like training data and post-training, I don't know. Versus like, can you get a miracle doctor with like fine-tuned data? Do you have to, what kind of data do you need to feed it? I don't really know. I'm not an AI researcher. So I think to get to very specific types of tasks like that, very specialized, is probably gonna be much harder than saying like, hey, let's make the new genius AI coder or genius AI lawyer, where we have like repositories of like tons and tons and tons of AI code or AI law or anything else that it can train off of. I think new medical discoveries is probably a more challenging task, would be my guess.
Hi. Which of the following two sources of challenge for the kind of entrepreneurship in this room do you think are more frightening? One is Epic has all the data. They don't have to be very smart, but they are in a position in control of data that may be more like Microsoft through the 90s, where they could stifle and deflect innovation and then acquire tactically and sort of slow things down and capture the value of the people in this room. So that's one problem. And the other problem is using AI to go into the wonderful business of selling garbage. 100% revenue goes to profit when you identify people who are vulnerable to scams. So people in the early stages of, have mild cognitive impairment or under the influence of meds or behavioral disorders or whatever, and they can be exploited, and they can be identified from all kinds of IoTs, simplified or disturbed linguistic use, and a whole bunch of other things. I don't want to, inspire people in that direction. But I'm really giving a lot of thought to the malign uses of AI producing such a profitable business that it will, they'll make so much money, they'll have money left over to obfuscate the issue, purchase the regulators, and basically follow the crypto playbook of 2024 with the current administration.
That great question. I think the Epic question is an interesting one, because you're right. Like Epic is a monopoly, and for all the promise that these AI scribe companies have, I know a lot of them are sort of worried because Epic is coming for their business model. And I'll say the counterpoint to that. People sort of assume Epic has all the data and they have all the data that matters. But now increasingly patients have access to their own data, and it's easier and easier for them to get their own data, so Epic's monopoly is maybe not as strong as it used to be. The second thing, this is sort of interesting, at my document we were thinking about when do we need to build EHR integration. We asked all of our users, how much do you want this? And so many of them, a surprising number, because I thought, oh, surely they want this. So many of them said, I don't want that junk in my doctor friend account. Because a lot of the data that Epic has is, I think folks know this, there's a lot of junk data in electronic health records. Because they've been optimized for billing, they're really sort of messy when it comes to data. So, take that as you might. I share your concern about fraud. Yeah, I think that's going to be a huge challenge, and I don't think the Justice Department is up for prosecuting. They're not very tech forward. There are not many of them anymore, and I don't think they're going to be up to the task of all the abuse. I share your worry.
I think at least on the second question, this is a problem with every single technological wave that pushes things forward, right? And so when email came out, there were a lot of email scams. I imagine when phone lines came out and everyone had phones in their house, I'm sure there were a lot of phone scams. When Bitcoin came out, it was used for like black market trading and all these things. So like every single technological wave has issues and problems because that's what people latch onto. And it will also have a lot of good entrepreneurs that are there to defend it. Like I know quite a few people who have pitched me like, hey, I'm doing like AI robo scam, auto detection, spam call prevention, like all these things that are particularly to prevent the patient population that you're referring to. And so how that's gonna play out, I'm not sure, but this is a problem with every technological wave. I think the bigger problem is probably, our system of encryption is, I would argue, fairly basic and based on technology from like 20 years ago of just like simple passwords, right? And so if we have new AI systems that are much more robust, much more powerful than before, like, is there a bigger fraud problem beyond just like robocalls, robo-scams, that sort of thing, or like even just cybersecurity? This is not an area that I'm particularly proficient in, but just putting out ideas of like, hey, like there might be like more macro level security issues that are unearthed because of AI, and I don't have the solution for that, quite frankly.
Yeah, I would agree on the perspective, Michael, you shared around the data. I think data will become more and more democratized, and the hold that Epic has historically had on clinical data and may have at present will slowly dissolve over time, because we see it already. We have much more ownership of our healthcare data, and all the other players are growing in their ability to share data. And at some point, the tide turns where all the providers that use Epic will have a strong enough demand to release the data that it will eventually happen. So I'm optimistic.
I'll add just one more thing to that, which is I think there's a tremendous amount of valuable health data that has never, ever been inside an electronic health record. I think it's sort of obvious, but it still amazes me. I log into Epic when I'm in clinic, and I think for 95% of my patients, I don't even have a photo of their face. So, we may know what people look like, we have their biomarkers, but we don't know what they look like. We don't know what's inside their kitchen, what's inside their fridge, like all these things that would be really important for understanding their health long term.
Okay, cool. It's been an hour, so I'm gonna close the panel. Everyone, please. Oh.
I have some swag for everyone to say thank you. So thank you very much for coming to our event. Here's some MIT CNC swag. It's a tumbler.
swag.
So yeah, thank you so much.
Maybe a round of applause to the panelists. Great. All right, thank you.
Thank you. Thank you, Afsana.
Cool.
Thank you, Colin,
Oh,
for
thank
being
you.
our
Oh,
host.
I get one too? That's
Yeah, of
awesome. I
course.
didn't do anything.
We're going to take a photo with the speakers.
Okay, sick. Can we get a photo if that's cool? Sure. All right. All right. This is awesome. Thank you.
Yeah.
Wow.
You're welcome.
Please. I want to stand up. Thank you so much.
Thank you.
That was
Tell me your name
beautiful.
again. You're Tom. Yeah,
Yeah,
okay, got
thank
your
you so
email.
much.
Yeah.